Schizophrenia by Brooklyn Bennett, Donald Schuster, Carolyn Salvador, Mark Mistretta, and Jessica Gonzalez. Introduction. Schizophrenia's exact cause is not known, but some of the things that may play a serious role in it are genetics, environment, and altered brain chemistry and structure. This illness is characterized by thoughts or experiences that seem out of touch with reality, disorganized speech or behavior, and decreased participation in daily activities. Most people, if you live in a big city, you see some form of schizophrenia every day, and it's sometimes in the form of someone homeless. Look at that guy. He's crazy. He looks dangerous. Well, he's on the streets because of mental illness. He probably had a job at home. Eric McCormack.
What is schizophrenia? Schizophrenia is a very common brain disorder which causes people to abnormally interpret their sense of reality. Symptoms: social isolation, compulsive behavior, self-harm, amnesia, belief that thoughts aren't their own, memory loss, anxiety, detachment, hallucinations, rapid speaking, and fatigue, among many others. Causes: there is no exact cause of schizophrenia. A family history of mental disorders and environmental factors such as drug use are identified as risk factors. Early signs: early symptoms in teenagers include withdrawal from friends and family, lack of motivation, trouble sleeping, depressed mood, worsening academic performance, and inability, among others. Treatment: treatment is symptom-based. Depending on the unique case, a combination of antipsychotic drugs and other means of therapy might be used in conjunction.
Many people with schizophrenia have an episode that really opens up their eyes and makes them realize that they have to do something about their illness. A lot of things that these people go through are delusions, obsessing over an idea and believing that it is true, hallucinations, hearing or seeing things that aren't really there. This goes hand in hand with delusions, as schizophrenics believe that these hallucinations are real. Disorganized speech or behavior. When speaking, they cannot express the thoughts they are thinking of in the right way. They act in a way that is not normal and believe that it is normal, so they do not expect unusual responses to it, and more. One patient with schizophrenia described the illness as follows: "Whatever this is that I have, I feel like I'm a caterpillar in a cocoon, and I'm never going to get the chance to be a butterfly."
This is the first step in getting back to a mentally healthy state of being. You have to learn to understand and accept your illness and the consequences that accompany it. This includes how it is affecting you and your family. This crucial stage allows for you to actually begin the process of getting well again. Accepting your disease or disability is a very important yet difficult process.
Treatment is the stage in which you begin to experience results and ultimately will be able to resolve the issue that you are currently having. The medication that is usually given is antipsychotic and anti-tremor medicines. Other alternatives instead of these drugs include support groups, rehabilitation, cognitive therapy, psychoeducation, family therapy, behavior therapy, and group psychotherapy.
There are many different things that you can do in order to be able to control your disease and limit the symptoms and actions that result from schizophrenia. These include, but are not limited to, distraction. Taking your focus away from the hallucination is one way to cope. Fighting back. Mindfulness techniques and avatar therapy also help. This will help you control and maintain a healthier mind without having to only rely on the treatment.
This is the stage where you have to truly accept your illness and have found ways to treat it, cope with it, and live a normal, happy life. Obviously, the life of the person who is ill will never be the same because they will have lived things that they will always remember, but now they will hopefully never have to live those things again.
Stigmas, misinterpretations. A stigma or misinterpretation can be defined as incorrect information that is associated with a certain person or a group. There are multiple stigmas that surround the mental illness of schizophrenia. These stigmas can lead to severe discrimination against people with schizophrenia. Some of them include schizophrenia is an untreatable disease. People with schizophrenia are usually violent and dangerous. People with schizophrenia are likely to infect others with their madness. Everything people with schizophrenia say is nonsense, and many more.
Let's review some concepts. Who? Schizophrenia affects men and women equally. It occurs at similar rates in all ethnic groups around the world. Symptoms such as hallucinations and delusions usually start between ages 16 and 30. Men tend to experience symptoms a little earlier than women. What? Schizophrenia is characterized by thoughts or experiences that seem out of touch with reality, disorganized speech or behavior, and a decreased participation in daily activities. Difficulty with concentration and memory may also be present. Why? The exact cause of schizophrenia isn't known, but a combination of genetics, environment, and altered brain chemistry all play a structured role. When? It is possible to see schizophrenia in ages 3 to 13, but these occurrences are very unlikely. There is more of a chance to see the disease from 14 to 60.
Our conclusion is that schizophrenia is a very serious illness. It can definitely change the quality of a person's life, going out with friends, relationships with families, finding work, and more. Schizophrenia is a mental disorder associated with a variety of symptoms, including hallucinations, delusions, social withdrawal, and cognitive dysfunction. With new research and expanding the knowledge for the cause of schizophrenia, the outlook for those living with schizophrenia continues to improve.